Thanks for watching our PPE video here on the COVID unit. I'm going to talk about the PPE we have, how far we've come, and how far we still have to go. So let's look at what I'm wearing right now. I have on a Tyvek suit, I have an N95 respirator, I have gloves, I have a bonnet, and this is my face shield. And this is awesome, right? I'm totally protected, ready to go, take care of my patients, give them all the care they need. This is a much, much better situation than we started out with a month ago when the state of emergency began. We were working in COVID rooms with no N95 respirators, with procedure masks only. We went through a period of time when we had to reuse dirty disposable gowns over and over again because we did not have Tyvek protection or an adequate gown supply. We right now, actually, we don't have any shoe covers, which we used to have. We used to have covers for our sneakers, and we're running low on the head covers, the bonnet that you see me wearing. And additionally, the N95 respirator that you see me wearing, this I'm wearing for extended use and indefinite reuse, which is not as the manufacturer intended and is not evidence-based. When I go for my lunch break, I will take this off, I will lay it on a paper towel, then I will put it back on my face in order to resume patient care. At the end of the day, I will leave this N95 respirator in a paper sandwich baggie in my hospital's lobby so it can be taken away to be experimentally cleaned with UV light, and then I can wear it over and over again on subsequent shifts. This is way, way, way less than ideal. It is a commendable emergency solution that hardworking people at our organization have come up with, but it is not a long-term solution, and we need to be extremely clear about that if we want the situation to improve and if we want our state level and federal agendas for protecting healthcare workers to advance.
So I'm sanitizing. I'm going to put my gloves on before I go in the room to don my Tyvek suit. So, what worries me is that as I put on this suit, I am trying to be careful because my shoes are dirty since we don't have access to shoe covers. We had a supply in the beginning a couple weeks ago, but we were actually told that shoe covers and bouffant caps are not needed for COVID precautions. So I'm just going to do the best I can here. But really, as I put my leg in, I need to be careful not to touch the back part. But if I do it right, I'll only contaminate the waist down. But it's really hard not to touch the back of the suit here, which is really my neck. So. Okay. Balance helps. I'm grateful for the protection, and let's see, yeah, they get tricky sometimes. So I have my suit. I'm ready to go into a room once I put my face shield on, and I have my N95 mask, which this is the second time I've worn it, which you can see by the tally marks on the side here. It smells a little bit funny. After they're sanitized, they do have a strange odor. But yeah, so I'd be ready to go in once I put my face shield on.
So thank you for watching our video. As we said before, we've got some great protections. We've come a long way, and we still have a long way to go. We particularly really need to change how things are currently being done with N95 respirator protection, because the way we're using these currently is not evidence-based and is not guaranteed to give us the protection we need. We have worked since this crisis began under a whole bunch of different policy configurations with different levels of PPE access at different times. We have experienced numerous undocumented occupational exposures, even while following PPE policy closely. And it's really important that employers acknowledge this, that they show respect for our experiences and the work that we're doing by recognizing that when we get sick, when we test positive for COVID-19, it's because we were exposed at work. Currently, healthcare organizations and hospitals are assuming a default position that healthcare workers, frontline workers who get sick with COVID-19, caught it out in the community at Stop and Shop instead of here on the COVID unit, where we're continuing to work with substandard PPE every day. So thank you so much for watching. Thank you for being aware of this. Thank you for supporting your frontline. And we're here to take care of you. Thank you.